As a prostate doctor, I've spent over 2 decades caring for elderly men, and there's something I need to say today, not as a doctor, but as someone who truly cares. I am begging seniors to stop ignoring their prostate health. I've seen far too many men suffer needlessly because they didn't pay attention to the early signs. I've had heartbreaking conversations with families who said he just didn't think it was serious, or he was too embarrassed to talk about it. That silence, that delay, often turns something treatable into something life-threatening. So please, if you're a senior man, or someone who loves one, listen closely. This message could save a life. The prostate is a small gland in the male body, about the size of a walnut. It sits just below the bladder and plays a role in making the fluid that carries sperm. As men age, the prostate often gets larger. This condition is known as benign prostatic hyperplasia, or BPH. It's common and not cancerous, but it can still cause serious problems. The problem is, most older men think these changes are just a normal part of aging and ignore them. But when you ignore symptoms like frequent urination, especially at night, a weak urine stream, or the sudden urge to pee, you might be allowing a bigger issue to grow unnoticed. And if that issue happens to be prostate cancer, then ignoring it could be fatal. Let me tell you about one of my patients. His name is George. George was a retired postman, 74 years old. He was the kind of man who hated going to the doctor. For over a year, he was waking up every night, sometimes 5 or 6 times, to go to the bathroom. His urine stream was slow, and he sometimes felt pain while urinating, but he brushed it off. Just part of getting old, he told himself. His daughter finally convinced him to see me. We did a simple PSA blood test, and the results showed something suspicious. A biopsy confirmed it, early-stage prostate cancer. Thankfully, we caught it in time. George received treatment and is now healthy and active. He later told me, "Doc, I nearly waited too long. I thought I was tough, but ignoring my body almost cost me my life." Stories like George's are common, but sadly, not everyone comes in early enough. Some men wait until the pain becomes unbearable. Others come in when they can no longer urinate at all, something we call urinary retention, which is an emergency. I've seen men develop kidney damage, bladder infections, and long-term complications, all because they didn't want to talk about it or thought it wasn't serious. The truth is, fear and embarrassment are hurting men more than the disease itself. The exam is quick, and for many men, just a blood test is enough to know whether something might be wrong. Let me explain what to look out for. If you are going to the bathroom more than twice during the night, it could be a sign your prostate is enlarged. If it takes a long time to start urinating, or you feel like you're not fully emptying your bladder, those are red flags. A weak or interrupted stream, sudden urges to urinate, and even leaking urine when you can't make it to the bathroom in time. All of these may be signs of a prostate issue. In more serious cases, there might be blood in the urine or semen, or pain during urination or ejaculation. These signs are not normal, and they should never be ignored. Now, I understand why many seniors avoid prostate checks. Some don't want the physical exam, some don't want bad news, and others think it's simply too late to do anything about it. But let me tell you this clearly. Finding a problem early gives you more options. If we catch prostate cancer early, it's one of the most treatable forms of cancer. Many men go on to live full, happy lives after treatment. And if it's just an enlarged prostate, there are medications, lifestyle changes, and simple procedures that can make a huge difference. Another patient of mine, named William, was 69 when he started having urinary problems. He waited for almost 2 years before seeing a doctor. When he finally came in, his prostate had grown so large it was blocking the flow of urine completely. He had to be rushed to the hospital and fitted with a catheter. He later needed surgery. William told me, "I thought I was avoiding trouble by ignoring it, but I just made it worse." Today, he tells every man he meets to get checked, even if they feel fine. So what can you do? First, schedule an annual checkup. If you're over 50, ask for a PSA blood test. If you have a family history of prostate cancer, start even earlier, around age 40 or 45. Keep track of your symptoms. Write them down. Don't brush them off as normal aging. Drink plenty of water, but limit caffeine and alcohol, especially in the evening. These drinks can irritate your bladder and move your body. Regular exercise helps reduce inflammation and keeps your prostate healthier. Most importantly, talk to someone. Talk to your doctor, your spouse, your children. Let them support you. You're not alone in this. Before I end, let me leave you with this message. If you've been putting off a prostate check, stop waiting. If you've been waking up all night, struggling to urinate, or feeling something isn't right, listen to your body. Ignoring it won't make it go away. I've seen too many good men suffer simply because they didn't act in time. Don't let fear or pride stop you from living a longer, healthier life. Getting checked is not a sign of weakness, it's a sign of wisdom and strength. Thank you for watching Eldering Wisdom 01. If this message helped you, please share it with someone you love. This conversation might save a life. And if you have questions, feel free to leave a comment below. We're here to help you age with strength, clarity, and wisdom. Stay healthy and take care of yourself.